joining us. It's Anita Lambert, your holistic health physio. And I'm here tonight with Jessie Mundell, who's a prenatal fitness instructor who teaches women all around the world, as well as coaches all around the world. And so today, Jess is going to be sharing her top 5 tips for exercising during pregnancy. And these are tips you likely aren't going to hear anywhere else. So please share that we're chatting today, as well as sharing the replay, and feel free to tag any expecting moms below in the comments so they can catch what we're chatting about. So for those who don't know me, I'm a pelvic health physiotherapist, and I've worked with hundreds of women during pregnancy to help prevent and resolve common pelvic floor and core issues. And I love collaborating with other fitness instructors, and Jess is one of my all-time favorites. And stay tuned to the end. We have an awesome project coming up that we're collaborating on, but we will leave that till the end. So yeah, if you're just joining us, please say hi, leave a comment below. We'll be sure to answer your question while we're live or after in the replay. So Jess, thanks so much for sharing these awesome tips, because I know both of us get asked these questions every day.
Yeah, absolutely. Yeah. Thank you for having me.
Yeah. So before we jump into the tips, if you can share just a bit about your background and how you actually work with women around the world and also help other coaches.
Yeah, for sure. So I started back in pre and postnatal personal training, fitness coaching when I was 19 or 20. I was doing my undergraduate degree at Queen's University in Kingston, Ontario, which is where I'm originally from. Yeah. And there was just some really incredible pregnancy exercise research going on at the time with some of the professors at the university. And that's kind of how I started just learning about this population and exercise during this time. So my first personal training job was at a studio in Kingston that was just prenatal and postnatal focused. And from there, I just was able to see all these pregnant mamas and these postpartum moms bringing their babes to classes and exercising, and started to hear about diastasis recti and pelvic floor and incontinence and prolapse, all of these things. So from there, ended up going to the University of British Columbia, doing my master's degree and focusing my research in pre and postnatal exercise. And the last 10 years have really just been all about learning more and more and more, training and getting my hands on as many bodies as I could, watching pregnant and postpartum bodies move, and now working with women all over the world. So when I got pregnant, I knew that I wanted to be able to stay at home full time with my kiddo, but this is my love and my passion too. So I wanted to be able to continue to do this work and also be a stay-at-home mom. So it's the best of both worlds, because I get to work with moms who are pregnant and postpartum all over the place. I work at nap time and after baby bedtime every day. So yeah, it's the best life getting to do both of these things.
And it's awesome too, because both so Jess's little one Steele and my little one Pippa are about 6 months apart. So both of us have gone through pregnancy, exercising during pregnancy, and postpartum recovery. So we definitely have personal experience, and then as well professional experience and expertise. So thank you so much, Jess, for sharing this. And so why don't we start with your first tip?
Yes, absolutely. Okay, so tip number 1 is that we want any and all exercise that we do during pregnancy to be pain-free and symptom-free. It seems so basic and so simple, yet it can be tricky when you are actually navigating pregnancy exercise. The body changes so much. We can have issues and symptoms pop up early on in pregnancy for some people nothing until the very later stages of pregnancy. But just knowing that wherever we are in pregnancy, let's try to modify around. Let's try to be treated like people who do the same work as Anita, or Anita, if you are close to her. Work with a coach who understands the pregnant body. And let's get you some modifications and substitutions that feel good on your pregnant body. Know that it does not have to be this thing that you endure and push through throughout an entire pregnancy. You can actually be quite comfortable exercising in pregnancy.
And so it sounds like you don't necessarily agree with the no pain, no gain idea, whether pregnancy or not, but I'm sure you hear that a lot, right?
Yes,
Yeah.
absolutely. I mean, we're inundated with that message so much in the fitness industry and on social media, and we see it seeping into prenatal fitness and strength training and exercise as well too. And there really, truly is no need and no place for it.
Yeah. And I think also just so many women are told, it's part of pregnancy, like pain comes with it, leaking comes with it, like all of this is just part of the deal. And then, as you said, like you see women also after birth. And then the same thing is just kind of like, this is just part of being a mom. So I think this is so key that women are understanding, like, to modify or change things. And also, just if you want to elaborate on, does modify mean like that you can't do high intensity or you can't do like higher weights or anything like that? Because I think some women hear, to back off and they immediately think, okay, I can't do weights or I can't do high intensity.
Yeah, that's a great point. So no, it does not necessarily mean that we're taking out the physical challenge or that we're taking out the intensity. We can keep the heart rate higher. We're going to get to that point soon, but we can keep the heart rate up. We can get breathless. We can challenge ourselves physically and mentally and exercise while we're pregnant. There's so many ways we can do that. My specialty is strength training. I think that it is one of the best forms of exercise that we can be doing in pregnancy if you like to do that type of exercise, if you're interested in trying it. There's so many ways we can modify the actual workout or how the exercises are pieced together in the workout, the sets, the reps, the rest between them, the actual modification of a specific exercise itself. There are just so many things that we can do in strength training to keep the challenge there if you want it to be there, and to also match that with pain and symptom-free movement.
Yeah. Yeah. And I think a lot of it like is strategy too, right? Like how to engage core and pelvic floor, because I find a lot in my practice just want to understand it's working. And if we can, create that efficient strategy and then they bring that into exercise, they're amazed of how much they can actually do. It's just maybe the strategy of how to engage their core or holding their breath wasn't really helping them. And so they're making that change.
Yeah, absolutely. And I think what is so cool with working with so many different bodies is that you get to play with that strategy. You get to play with the alignment, the breath, when you're inhaling, when you're exhaling, and you just play and you see what works for you at different stages of your pregnancy in different exercises. And you're just testing and tweaking as you go through.
Totally, totally. And so what's your second tip for exercise in pregnancy?
Okay, so tip number 2 is that the heart rate guidelines that we have been given and that we have heard for decades now about, usually what we're hearing is that 140 beats per minute is your maxed out. Do not go higher than that during exercise in pregnancy. And that's not really the case. There's a bit new research that has come out since that 140 beats per minute top of the line guideline. But really knowing that you actually don't have to track your heart rate during pregnancy exercise. You can, absolutely. It's kind of cool information. I did a little bit of that during pregnancy, but you do not have to. You do not have to stick to hard and fast pregnancy heart rate guidelines. What I love to do with my clients is talk about rate of perceived exertion. So really figuring out how hard does this feel for me right now in this workout, on this day, in this phase of pregnancy. And you'll probably find that changes a lot. So with my clients, we do a workout phase or a program of workouts for 4 weeks, and then we rotate and progress to the next set for another 4 weeks. Workouts are always changing, different exercises are coming in. But what's cool about that when we stick to a phase for 4 weeks is that we actually can see how we feel during the same workout, during the same exercises, but on different days, on different weeks of pregnancy. So we always go back to that RPE though, the rate of perceived exertion. How do I feel? How hard, how tough, how challenging is this today during this exercise in this workout? And then we can talk about the talk test as well too. So can you speak? Can you carry on a conversation? Can you string some sentences together? Of course, you're going to be a little bit breathless, and that is a good sign of a challenging workout. Again, if that's what you're going for. But to say that we have to max out 140 beats per minute for every pregnant body in every workout, not really the case.
Yeah, no, I think that's such key information. And so, because it's true, there's like, I find so many women come in to see me and they're like, well, this is what, Dr. Google says in terms of exercise, like what's the deal? Is this updated or not? So I think this is such key information. Mm-hmm. And then kind of going back to what we talked in the first question, how let's say if a woman has symptoms, let's say she's a runner and she wants to run during pregnancy, but she has symptoms. So maybe she needs to learn a new strategy, step back from running a little bit, but she wants to keep her heart rate up and keep the cardio aspect. So how, with your strength training background, how do you bring that into exercise in terms of getting their heart rate up with weights?
Mm-hmm. Yeah. So we work in circuit style strength training quite a bit. So we do supersets or trisets of exercises quite often. So we're pairing 2 different exercises together, 3 different exercises together sometimes, and we're rotating through that circuit. So I don't love to program specific rest times, especially in pregnancy and earlier postpartum. We like to say, as my coach Jill Coleman says, just rest as much as you need to. That's basically it. So if we go back to rate of perceived exertion, how hard does this feel for you? How hard do you want this to feel for you? Because that's going to be different for different people. Then you can tune into that. You can rest little and get back in quicker, and then your heart rate's going to stay a bit higher, or you can rest longer and allow the heart rate to recover and then get back in when you're ready. So what I think is so key in this, though, is knowing that your heart rate does not have to stay sky high throughout an entire 20-30 minute session of exercise. The beauty of strength training is that and interval training too, is that we can push, physically challenge the body, get the heart rate up, and then rest, allow it to come back down, feel more recovered, more rested and ready, and then get back in to the exercise or the circuit and feel like we're able to challenge ourselves a bit harder, maybe lift a bit more weight, do the reps really nice and cleanly, and just feel good and confident and comfortable throughout the whole workout rather than needing to lie on the floor for 5 minutes after we're done.
Mm-hmm. Yeah, no, I think that's such great information because I think there are a lot of women who don't necessarily know in terms of interval training, just that they can get their heart rate up and they can still get that high intensity workout if maybe high impact is something they need to change up for whatever reason. So I think that's awesome info. Awesome. So what's your tip number 3?
Good thing I wrote these down because my mom brain cannot handle this anymore. Okay, tip number 3. This is actually probably my favorite one and the one that I talk about most often with my clients is could you versus should you? This is something that I ask myself often during pregnancy exercise. I have a long background with competitive sports and strength training. So I know what it feels like to push myself hard. I know what it feels like to want to do more when maybe my body is telling me to take a step back. And that's been a really difficult and years-long process for me to actually learn. So in pregnancy, I kept checking in with myself. Can I lift more? Yes, I probably could in 80% of the cases, but should I actually lift more? What is the benefit of that going to be? Is it a risk versus reward type situation? What are the pros? What are the cons? So going back to, could I do this? See what the answer is there. If it is a yes answer, just check in to see if that really is something that is going to be beneficial for your body in the short and the long term. Yeah.
No, I think that's really well put. Cause I mean, and now with social media, right? Like I think back to I talked to friends who were pregnant even like 5 years ago and there wasn't all of this out there, like especially Instagram, you're seeing pictures everywhere, women doing all different types of exercise and some women being congratulated on what they're doing and other women not so much or feel like they aren't. And definitely like everyone is so different on what they can handle. And I feel like with social media, you don't necessarily know what's behind it. So you don't know if someone's working with a pelvic health physio and maybe they do have a great strategy with what they're doing, or maybe they don't, or maybe they're doing something that you think looks impressive, but they're leaking or they have pain. So the idea of that, it's checking that ego at the door and knowing what works for you and what feels good in your body. And that's what I love in terms of what you're always putting out there, Jess. So for anyone watching who doesn't follow Jess, you need to follow her on Facebook and Instagram at Jessie Mundell, because she's always posting kind of the real deal in terms of motherhood as well as exercise and pregnancy or postpartum. So thank you so much, Jess, for keeping it real, basically, in terms of with exercise and just motherhood in general.
Yeah, absolutely. It's almost like, and I have a blog titled this on my website, Pregnancy Exercise Badge of Honor. And it's exactly what you said. You see this congratulatory commentary for women who are doing this exercise that looks really heavy or really intense during pregnancy. I just did an Insta story about this the other day, but those comments are most often like, you're a badass. Look at what you're doing. That's incredible. And absolutely, that's incredible. But you know what's cool too? Resting and moderate exercise and leisurely walking. All this stuff is great. We can't do pregnancy exercise better or worse than the next person.
Yeah. And from perspective from a physio, like I've seen women who've done all sorts of exercise during pregnancy, and one does not guarantee another in terms of postpartum recovery or postpartum, just kind of how efficient recovery is. When just because you're doing high intense doesn't mean it's going to be negative, but doesn't mean it's going to be positive either. So figuring out what works for you and working with a support team around you to figure out kind of how that is best done for you too is helpful. Awesome. And so what's your fourth tip, Jess?
Okay, number 4 is that exercise programming during pregnancy should look different as we move through pregnancy. So it should look different in the first trimester, second trimester, third trimester. You do not have to feel like you need to keep up with whatever you were doing pre-pregnancy, with whatever you were doing in the first trimester or second trimester. It doesn't have to look the same at 35 weeks pregnant. Just giving yourself a lot of grace, a lot of compassion that things are going to look different. What's going to be comfortable will change. The amount of weight you're going to be lifting will change. The amount of weight you're carrying in your body will change. And that is going to dictate the exercise programming that happens. So this is why I love structured strength training programs through pregnancy. This is why my clients love it, because they can just look at the plan, do the exercises, and not have to think too hard. Of course, they're thinking about how it's feeling in their body, but they don't have to program it themselves. They don't have to think about the specific changes that need to occur in each different phase, in each different week. But knowing that your exercise programming should look different from start to end of pregnancy.
No, I think that's really, really key. And so what would you say, what are some differences between the different trimesters in terms of with yourself when you were going through pregnancy or with clients you work with?
Yeah. So first, I'll say personally for me, first trimester was a lot of just checking the boxes. I was very sick from immediately pregnant, basically until 22-ish weeks pregnant. And then again from 32 to 42 weeks pregnant. First trimester, strength training and walking actually made me feel better. It was a bit of a distraction, a bit of a break from the nausea. So that was nice, but it was also a lot of resting between sets, between exercises, a lot of lying on the floor just because I needed to just like recenter mentally. But that's kind of how it's built in our first trimester strength training programming for my clients, is that there's lots of opportunities to rest. There are a lot of seated exercises done. There are a lot of supine exercises done, exercises on an incline bench. So the mentality around how does it actually feel in first trimester for a lot of people when they're nauseous, when their energy's down, when they're fatigued, when they're maybe not eating as much, we take all that into consideration in the first trimester. We tend to keep the focus Is that me that's making that feedback, or we're good?
Oh,
Okay. So we just keep the energy demands of the body into play in what the exercise situation is looking like. Maybe that means no interval training at all, and we just keep it to strength training, leisurely walking. Perfect. Second trimester, maybe we're able to ramp it up a little bit in terms of the actual intensity, in terms of the volume or frequency of the exercise sessions. And then towards the end of the second trimester, maybe we're taking things just from a little bit different perspective, especially in terms of the actual modification of a squat and a deadlift. Maybe it doesn't feel good to squat under a barbell anymore. Maybe it doesn't feel good to be in a conventional deadlift stance. Maybe we go to a sumo or a trap bar stance. And then third trimester, lots of things can change in the third trimester. For me, that was when my body really started to change. I didn't really show too much until mid-20-ish weeks. So not much changed in terms of the exercise specifics for me. So then it was really interesting to feel that in the third trimester, how you literally just don't feel comfortable in certain positions. At the bottom of squats, it just felt like my belly was bulging out, and that didn't feel good to me. So we just take the individual situation into account through that third trimester quite a lot. For some people, pelvic pain ramps up, maybe SI joint pain, pubic symphysis pain. So maybe we need to stick to more bilateral exercises, take some unilateral stuff out. So things can get really different for a lot of people during that third trimester. But biggies in the third trimester, we're going to incline bench position versus flat bench positions, for example. We're doing lots of sideline type exercises. We're not spending a whole 30 minutes workout session on the feet. We're mixing up the positions of the body quite a lot. Standing, sitting, incline bench, sideline, things of that nature, just to give the pelvis and the core a bit of a rest.
Oh, I think that's awesome. So many different great tips for women to think about. And we'll talk a bit more after, because I want Jess to be able to share more about her programming and how you can work with her. If anyone's joining us, make sure to say hi, leave a comment, let us know in terms of any questions that you have for Jess, and I'll make sure she gets a chance to answer them live or after on the replay. So what would be tip number 5 for exercise in pregnancy?
So I'm, of course, extremely biased to strength training, but I think strength training is one of the most perfect forms of exercise for pregnancy because it is so modifiable. We can change so many different variables just in terms of the strategy we're using with alignment, breath, exercise technique, but also the exercise themselves and how exercises are pieced together to create a workout plan. It's an art and a science, and I think it works so perfectly well with a pregnant body. And for me, I always joke, but it's not a joke at all, that I was most comfortable strength training at the end of pregnancy, more comfortable than I was sleeping, because let's be real, that's the worst at the end of pregnancy. Rolling over was maybe the
8-point turn to roll over. Yeah.
Yeah. So I felt more comfortable strength training than doing literally anything else at the end of pregnancy. It was just such a nice physical and mental and emotional break for my body at that time. So I think, and I see it with my clients too, we can just keep so many people moving throughout those later stages of pregnancy. For example, for me, for lots of my clients, walking does not feel that good at the end of pregnancy for more than, say, 5-10 minutes at a time. But we can get through a 20 or 30 minute strength training session because we are getting the body in so many different positions. So I'm a big fan of strength training during pregnancy so we can keep mamas active as long as possible for physical, mental, and emotional health.
Yeah, no, that was me as well, keeping it up right until the end. And I think a lot of times too, women think, oh, okay, I have to either strength train or not. And I think having a balance, like especially in the third trimester, I really encourage women to do a lot of release work. But that doesn't mean you can't also strengthen. So doing, the strengthening, but making sure you're still learning how to open the pelvis, release your pelvic floor, learning how to let go. Because when we're in labor, and I know, Jess, you talk about this too, like in labor, you want to be able to let go. You want to kind of let any tension out. So that idea of balancing. But I also think strength training is so key because after baby comes, you're doing a whole lot of strength training in your own way after birth, right? Like a lot of picking up car seats, even if you get the lightest car seat, it is not super light, especially when you had a baby, and strollers, right? Like there's a lot of heavy lifting after. So doing that in pregnancy to prepare your body for the postpartum part of motherhood, I think is so key. And just you'll see the benefits afterwards and feel them afterwards of how well it helped with postpartum recovery while you were still pregnant.
Yeah, it's such a physical gig right from the get-go. Immediately once you give birth, like really truly there's very little to no rest time whatsoever, and you're just thrown into this 24-hour a day situation where you need to be able to use physical strength in your body. So important.
Yes, and on less sleep. Jess and I were chatting about that before we came on live. So that's another aspect of motherhood. And then, yeah, just the strengthening. I just feel like it's only beneficial to do that during pregnancy. Awesome. So Jess, do you want to chat a bit more? So how can women find you? How can they work with you? Because you're mainly online now.
Yes. Yeah. Fully online. So my website is jessiemundell.com. You can probably link it below if you want to. And I have a few different options. One is a do-it-yourself program called Core Plus Floor Restore. That's for moms who are newly or a bit later postpartum and really just trying to get a handle on how can they feel a bit more stable, confident, comfortable in the actual core and pelvic floor. So diastasis recti, healing and recovery, pelvic floor support in terms of prolapse and incontinence. Do-it-yourself program. Other option is to pregnancy and beyond, and that is where I work with clients. So it's a group coaching program, but we are as customized as we possibly can be. Our private Facebook group is the best. It really, truly is the best group I've ever been a part of. There's just so much conversation. I get to check in with people daily there. So that's where I coach people in pregnancy and postpartum strength training programs. And then third option is specifically for fitness professionals and health professionals, whatever field you might be in, who are learning how to best support moms in their return to postpartum core and pelvic floor work and strength training exercise. And that is called the Postnatal Fitness Specialist Academy. And Anita is a guest lecturer on there.
Yeah, it's been amazing to be part of it, and just some really amazing fitness and health professionals have been going through it. So to be able to connect and chat with them, and the questions are amazing. So I know everyone takes a lot out of your course and can just build it right into either their health professional practice or their fitness professional practice. So, and that just benefits moms all around. So it's pretty awesome.
Yeah, it's a fun one.
Excellent. And Jess, how can everyone find you? Kind of Facebook, Instagram, whereabouts are you online?
So Facebook page is Jessie Mundell, Instagram, Jessie Mundell, and YouTube as well, Jessie Mundell. So those are the places where I'm most active for sure. Facebook and Instagram, you will find me there the most.
Awesome. Excellent. So yeah, and if anyone watching in terms of you're wanting more tips and resources on how to help have a positive pregnancy and positive birth experience, I'll post my free e-resource guide below with tips and resources I used myself and I recommend to clients. And I'll be sure to link all of Jess's resources and links below as well. And then, yeah, make sure you stay tuned. Check both of us out on Facebook. So the Holistic Health Physio page and Jessie Mundell Facebook page, because we'll be on Facebook Live more often. And we're really excited because what are we up to for 2018, Jess?
So we have a big thing coming in 2018 that actually has been in the works. We probably started talking about it, my gosh, almost a year ago, maybe probably a year ago this fall that we started talking about it. But Anita and I are going to be releasing a podcast together Yeah, in 2018. So our podcast is coming. We, of course, will fill you in on all the details, the name, where we'll be, the topics we're going to be speaking about, but definitely going to be focused in birth, babies, motherhood, fitness, core and pelvic floor, all this kind of maternal health world that we love so much.
Mm-hmm. Yeah, no, we're super excited. And we would love your input too. That in terms of we want to know what all of you want to hear about. Because both Jess and I love listening to podcasts. I started listening to podcasts when I was pregnant and started getting onto them. And then after giving birth, with all the stroller naps I've been on, I definitely have listened to a ton of podcasts. So I know a lot of moms out there, I'm sure, have experienced that too. So we're excited to be able to create a podcast just for you and exactly what you're looking for. So stay tuned, more information from both of us about that. So awesome. Well, thank you so much, Jess, for joining and for your amazing expertise and input. And I'll be sure to post all those links below, and stay tuned because we'll be back together on Facebook Live. So thanks for joining us.
Thank you.